Hi, my name is Dr. Cabanas, and I am one of the hospital doctors here in Danville, Virginia, and I've been working here for more than 4 years. Welcome to our weekly COVID-19 provider update. As you see in the news, COVID-19 cases, hospitalizations, and deaths have been rising across the U.S. And locally, Sovah Health is currently treating 51 patients on both of our campuses, with 30 in Danville and 21 in Martinsville. You may notice that this number is less than our last update, but it's important to note that these numbers fluctuate daily. In the last 2 weeks, Danville has reached its highest number of patients with 33 last January 4th. Meanwhile, in Martinsville, it has reached 28 patients last December 23rd. I strongly urge our community members to be more diligent with their efforts to slow down the spread of the virus, especially in the coming weeks to months. I would like you to know that our hospital have adequate capacity with inpatient care, including intensive care areas. Sovah Health continues to operate under limited visitation policy. That means that we are unable to allow visitors in our inpatient unit. In our emergency room, outpatient surgical, and outpatient ancillary services, we are able to allow one well visitor. Please go to our website at sovahhealth.com for more details of this limited visitation policy. The policy is located on our COVID-19 preparedness page. You'll find a link to this page at the very top of the website. Each update, we would like to share tips on how to stay safe in this COVID-19 pandemic. So let's say you were exposed to someone who was diagnosed with COVID-19. Stay home and away from others for 14 days after your last contact with that person and monitor your health. It's very important that you stay away from others, especially people who are at high risk for getting very sick from COVID-19, and that includes our elderly and immunosuppressed individuals. With up to 40% of those infected showing few to no symptoms, the virus can spread quickly. So now let's talk about what to do after you got tested for COVID-19. Stay home and monitor health. Follow the same guidance as I just mentioned to stay away from others. Remember, symptoms may appear 2 to 14 days after exposure to COVID-19. Follow our health department's guidelines when you receive your COVID-19 test results. So now let's talk about what to do after you receive your test result, whether it's positive or negative. Right. So let's say the result is negative and you do not have any symptoms. Remember that a negative result before the end of your quarantine period doesn't mean and doesn't rule out any possible infection. You need to stay quarantined for 14 days, and that's very important. In the absence of any symptom, you do not need a repeat test. This time, what if you have negative tests and you have symptoms? You should still continue to stay away from others for 14 days after your last exposure to COVID-19 and follow all recommendations from the health department. A second test and additional medical consultation may be needed if your symptoms do not improve. If your symptoms worsen or become severe, you should seek emergency medical care. This time, what if you have positive results with or without symptoms? Stay home and away from others except when getting medical care. Monitor your symptoms. If you have an emergency warning sign, including difficulty breathing, seek emergency medical care immediately. Stay in a separate room from other household members and use a separate bathroom if possible. Avoid contact with other household members and pets. Don't share personal household items like cups, towels, and utensils. Wear a mask when around other people if able. I'm very happy to share that Sovah Health has been administering vaccines to our frontliners. Even though we're not quite there yet, we are definitely heading towards the light at the end of the tunnel. We call upon every community member to lead by example. Wear a mask over your nose and mouth, wash hands frequently, practice social distancing, and avoid group gatherings if possible. Together, we can make a difference and make our communities healthier. Again, I would like to reassure you that it's completely safe to come to our hospital should you or your loved ones need care. Thank you.